So today I'm going to talk about how registered nurses and nurse practitioners can participate in activities that are related to cannabis for medical purposes. So currently, the Colleges Council has authorized two methods of registered nurses and nurse practitioners to participate in activities for cannabis for medical purposes. And those are RNs and NPS can administer or distribute cannabis for medical purposes, and NPs only can authorize the use of cannabis for medical purposes. And the Colleges Council has approved two documents which outline the legislative and regulatory requirements for RNs and NPs who are contemplating participating in the administration or distribution or the authorization of the use of cannabis for medical purposes. And the first document is a regulatory direction on the administration and distribution of cannabis for medical purposes by RNs and NPs. And this originally was sent out in December of 2018 as a memo. But as we learned more about cannabis, we had an open forum with the regional health authorities that wished some direction on RNs and NPs and the LPNs. It was a collaborative document that we did, and it was a memo that we sent out to and posted to our website for members. And we felt that we would then formalize that memo into a regulatory direction, and that can be found on our document library under regulatory documents. And then we have a regulatory document for nurse practitioners wishing to participate in activities that authorize the use of cannabis for medical purposes. And this document, too, is available on our document library under regulatory documents. So here's a picture of the two documents. The first one on your left is for nurse practitioners wishing to authorize the use of cannabis for medical purposes, and then the regulatory direction that provides that legislative and regulatory requirements for those RNs and NPs wishing to participate in the administration or distribution. And as I said, they're found under our document library, under regulatory documents. So the Canadian landscape prior to October 17th, 2018 found that the use of recreational cannabis was illegal. So prior to October 17th, it was illegal, and the use of cannabis for medical purposes was regulated through 4 pieces of legislation. And those were the Access to Cannabis for Medical Purposes regulations, and they were, I think, originally written in 2014, which allowed cannabis for medical purposes, and they were updated in 2016 to the Access to Cannabis for Medical Purposes regulations. There's also legislative requirements that are found in the Narcotic Control Regulations, the Controlled Drugs and Substances Act, and the Food and Drug Act. And as I said, prior to this date, the use of recreational cannabis was illegal. And then on October 17th, 2018, cannabis became legalized. And on June 21st, 2018, the Act Respecting Cannabis and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, and this was known as Bill C-45 and C-46, received royal assent. And the Cannabis Act, as of October 17th, the Cannabis Act and the Cannabis Regulations became the primary federal laws governing cannabis in Canada. And the Access to Cannabis for Medical Purposes regulations, 2016, were repealed, and the use of cannabis for recreational purposes was legalized, and legislative requirements for the use of medical cannabis were modified. So just to, I guess to reiterate that the use of recreational cannabis became legalized, and there were amendments made to allow or modify the use of cannabis for medical purposes. So the relevant legislation that outlines the legislative requirements for cannabis are as follows. So under federal legislation, the Cannabis Act is referred to as Bill C-45, and I just mentioned Bill C-46, and these were amendments to the criminal code related to drugs and alcohol impaired drivers. So this is a piece of legislation that outlined what was a criminal offense to be driving under the influence with drugs and alcohol separately or combined. And the piece of legislation that speaks specifically to cannabis for medical purposes is found in the cannabis regulations under Part 14, and it's called Cannabis for Medical Purposes, and this replaced the access to cannabis for medical purposes regulations. There were also changes to the Controlled Drugs and Substances Act and the Food and Drug Act to allow participants and healthcare providers and producers and resellers for selling cannabis. And then there's also provincial legislation that came into force on October 17th that I guess allows that activities to occur at a provincial level, and they were the Cannabis Control Act, and this received royal assent in May 2018, but again did not come into force until the federal legislation came into force on October 17th, 2018. And this act required amendments to 3 pieces of legislation as well: the Highway Traffic Act, the Liquor Corporation Act, and the Smoke-Free Environment Act of 2005. So under this new legislation, so what does it say specifically for the federal legislation? And I point out that there is a difference between the federal and provincial, and it has to do with the age of possession or distribution, and I want to bring forward that point. So under the federal legislation, it is an offense to possess or distribute an equivalent to more than 30 grams of dried cannabis in a public place for individuals 18 years of age or older. And adults cannot distribute cannabis to an individual who is under the age of 18 years of age. And those under the age of 18 cannot possess or distribute the equivalent to more than 5 grams of dried cannabis. Whereas in the provincial legislation, it says a person shall not sell or otherwise supply cannabis or a cannabis accessory directly or indirectly to a person who is under 19 years of age. And in addition, a person who is under 19 years of age shall not give, provide, or supply cannabis or a cannabis accessory to another person. And under the Cannabis Regulations Part 14, the maximum amount of cannabis that an adult is authorized to possess in a public place is an amount that is equivalent to the lesser, and this is for cannabis for medical purposes, so it's equivalent to the lesser of 30 times the daily quantity of dried cannabis indicated on the individual's registration document, or if they have more than one registration document, 30 times the total of the daily quantities indicated on the registration documents, or to a maximum of 150 grams of dried cannabis. For a hospital patient, it is 30 times the daily quantity indicated on the label that is applied to the container that was provided to or for the patient, or 150 grams of dried cannabis. So for dried cannabis, cannabis for medical purposes, the maximum that a person can have in their possession is 150 grams, and the other specific specifications. So there are a number of key definitions that authorizes possession and distribution of cannabis for medical purposes, and it's really important to, I guess, to be aware and understand those definitions. So the very act of a registered nurse or a nurse practitioner being able to administer or distribute cannabis in a hospital setting or in a patient's home flows first from having the ability to possess it and then distribute it. So under the Cannabis Regulations 2018, possession is defined as a person is deemed to be in possession when the person has the substance in their personal possession, knowingly has it in their actual possession, or custody of another person, or has it in any place, whether or not that place belongs to or is occupied by them for the use or benefit of themselves or of another person. Then the word distribute or distribution. And distribute is defined as administering, giving, transferring, transporting, sending, delivery, providing, or otherwise making available in any manner, whether directly or indirectly, and offering to distribute. So this is where that definition of what healthcare providers would do in administering cannabis. Next. And then in the previous legislation under access to medical purpose for regulation, they talked about administration and self-administration, but we no longer use those words. In the new legislation, the cannabis regulation, it refers to assistance by adult. So under subsection 269(2) of the cannabis regulations, assistance by adult is defined as an adult is authorized to administer, give, transfer, provide, or otherwise directly make available to the individual to whom assistance is being provided a quantity of cannabis other than cannabis plants or cannabis plant seeds that does not exceed the maximum amount that the adult is authorized to possess under subsection 266(6). So there are sections of the legislation that gives authority to administer or distribute in a hospital, and this authority comes from section 348(2) of the regulations, and it reads that the cannabis regulation permits an individual in charge of a hospital to allow cannabis products other than cannabis plants and cannabis plant seeds received from an holder of a license for sale or holder of a license in processing to be administered to an inpatient or outpatient of the hospital, or distributed but not sent or sold on receipt of a medical document or a written order. So this is where it's allowing those activities to occur within a hospital setting. Next slide. So again, I'm referring to pieces of legislation that allows RNs and NPS to participate in the administration and distribution of cannabis. So the next piece of legislation is section 349, and this section authorizes hospital employees to be in possession of cannabis products where they've been lawfully obtained and are being administered or distributed to an inpatient or an outpatient of the hospital, and the employee requires the cannabis products for purpose of and in connection with their employment. So it's allowing you to be able to be in possession of the cannabis in order to administer it to the client. But what about those who are in their in the public health or the community care settings? Well, nurses can administer medical cannabis outside of a hospital setting, and the Cannabis Act and regulations contemplate administration and possession in a hospital and in a public place. And these parameters are set out in the definition of possession and the subsections of the legislation of 266(1), 266(1)(f), 266(6), 269(2), and of the cannabis regulations. And the Cannabis Act defines a public place as any place to which the public has access of right or by invitation, expressed or implied, and any motor vehicle located in a public place or in any place open to public view. And according to the Canadian Nurses Protective Society, which is our liability protector, they provide our liability insurance. They say that the public residence, their interpretation of the law, a private residence falls under public place, so RNs and NPS can administer or distribute in a person's home. So by reviewing these pieces of legislation, and if you haven't read these pieces of legislation, and legislation is really difficult sometimes to read, but just having a read through of these sections, you'll get to understand what that the legislation that allows RNs and NPS to have it in their possession and to assist with administering the cannabis for medical purposes within a hospital setting or within the private residence. And then we question, because in the previous slide I talked about you're not able to provide cannabis to individuals in Newfoundland under the age of 19. So how do we, as registered nurses and nurse practitioners, be able to administer to children or mature minors? And this is actually laid out in legislation. And nurses can administer medical cannabis to mature minors or children through authority provided in the following subsections. And again, they're very similar to the ones that's laid above, and doing it outside of a hospital setting. So there is legislation that allows a nurse to administer it to pediatric patients, and those are the subsections that would apply and authorize a registered nurse to do that. So what about those registered nurses and nurse practitioners who question or have some moral dilemmas on whether they want to be able to participate in providing, in administering or distributing cannabis to clients? And through the Canadian Nurses Code of Ethics, RNs and NPS can conscientiously object to the administration or distribution of cannabis for medical purposes. And the registered nurse and nurse practitioners should reflect on their code of ethics and determine if they're willing to participate when faced with this ethical dilemma. And if nursing care is requested that conflicts with a nurse's moral beliefs and values, but is in keeping with the professional practice, the nurse is expected to provide safe, competent, compassionate, and ethical care until alternate care arrangements are in place to meet the person's needs or desires. And if nurses can anticipate a conflict with their conscience, they have an obligation to notify their employer in advance so that alternate care arrangements can be made. So I guess to summarize that, if nurses are expected to administer or distribute cannabis, and they have a moral dilemma, and they know that before they reach that point in their nursing care that they need to administer it to the client, then they should have those conversations with their manager, so that there can be plans put in place that maybe you would not be assigned to that client that day. But you need to reflect on and have those conversations, hopefully before you're faced with that particular requirement of care. So we have a document, as I have mentioned previously, called a regulatory direction, administration and distribution of cannabis for medical purposes. So RNs and NPs may engage in activities related to the care of clients receiving cannabis for medical purposes, if the following conditions are met. So the RN and NP would need to reflect on and determine if they're able to meet these requirements before they administer and distribute cannabis. And I'll go through these requirements that the NP and RN need to reflect on. And before you administer and distribute, then the RN and NP must be knowledgeable of the applicable federal legislation. And that would be the Cannabis Act and the cannabis regulations. And we've had an update of pieces of legislation to include the 3 new classes of cannabis. So, if you're participating and administering and distributing cannabis, you need to be aware of the legislation. Now, as I said, cannabis legislation is very difficult, as any legislation is sometimes difficult to understand, and you can certainly connect with your legal counsel within your organization, professional practice. You can certainly connect with CNPS if you have difficulty understanding, and often employer policies will address and further explain in policy the legislative requirements. But specifically here would be the Cannabis Act and cannabis regulations, the Controlled Drugs and Substance Act, and the Food and Drug Act, and also any provincial legislation. And as I mentioned before, there was 4 pieces of legislation that talks about and lays out the provincial legislative requirements, and they, for one, would be the Cannabis Control Act. And then as we say in any scope of practice, so when a registered nurse is determining if it's within their individual competence, meaning are you educated and authorized, is to determine do you have that necessary knowledge, skills, and judgment. So it has to be in that individual competence. So you need to be educated and you need to be authorized to administer or distribute cannabis for medical purposes. And as I said, and when you talk about competence, is if you're going to administer and distribute cannabis for medical purposes, you need to have the necessary knowledge, skills, and judgment and individual competence to administer or distribute cannabis safely. And you need to be aware of what you need to know about cannabis. So you need to know about how you evaluate its effectiveness and identify and manage adverse effects following the administration of cannabis, including but not limited to properly understanding the different forms of cannabis. And a little further on, I'll review the forms of cannabis and how the forms of cannabis, for example, like dried leaf or oil or edibles, may impact dosages and having any interactions with drugs that people may currently be on. And knowledge, as I said, of possible drug interactions, the risk of the usage, side effects, contraindications, and the risk to children and pets, particularly with these new edibles that are coming online. And also in scope of practice, so you're educated, you have the necessary knowledge, skills, and judgment, but you also have to be authorized through policies, guidelines. And in the legislation, it says that the administration and distribution can only be undertaken if the hospital permits it. So RNs and NPS should be aware of what the employer policy is, and if there is no policy, then to advocate for that policy. And also, they should also refer to their medication management document to be knowledgeable of that. And as I said, it is very important for the RN and NP to know their employer policy, and if no policy exists, is to advocate for with their employer for the development of a policy. Then the RN and NP must verify that the client has a medical document or a written order to authorize the administration or distribution. And within a hospital setting, generally there is a requirement for a client-specific order. So a client will bring in their medical document and present that to the medical practitioner or the nurse practitioner. And there will have to be a client-specific order, and the nurse is responsible to review the written order authorizing cannabis for medical purposes to ensure it meets all the required elements, including the daily quantity of dried cannabis expressed in grams that the healthcare practitioner authorizes for the client. Importantly, registered nurses and nurse practitioners must have a reliable means of authenticating the cannabis. And that means it has come from a licensed producer. And clients who receive cannabis for medical purposes from a licensed producer are often expected to present the nurse the cannabis in a container that will generally include a description of the content. Then I guess, determining how the employer wants that cannabis to be secured in a manner to prevent tampering. And as we say in medication management, we have to know what we're giving to our client. So there must be a means of being able to authenticate what that cannabis is before you administer it. So oftentimes, the clients receive their medical cannabis from a licensed producer. That's how medical cannabis is received in Canada, and it should, be sealed and have the proper labeling. And in the cannabis regulations, it outlines what would be on a label. So to reflect on also what the policy is on how you store the cannabis. And then the registered nurse or nurse practitioner ensures that there's informed consent has been obtained from the client. It is the responsibility of the nurse practitioner or the medical practitioner to both determine whether a client has the legal capacity to consent to the treatment and to obtain informed consent. And finally, RNs and NPS document the assessment of the client, discussions regarding consent, procedures, collaboration, and communication with the healthcare team, and any other pertinent information in accordance with legislative and regulatory requirements, documentation standards, and employer policy. So now we're going to move on to, so that's what's required. Previously, what I've discussed is what's required if an RN and a nurse practitioner wishes to participate in activities related to the administration or distribution. Now we're going to talk about the nurse practitioner authorizing the use of cannabis for medical purposes through a medical document. And the legislative and regulatory requirements are outlined in our regulatory document called Authorizing Cannabis Authorizing the use of cannabis for medical purposes. So previously, MPs prior to October 17th, 2018 were not authorized by the Nurse Practitioner Standards Committee nor CCRNR's Council to authorize the use of cannabis for medical purposes. And I'm going to explain a little further what that means. So under the cannabis regulations, a healthcare practitioner is defined as a medical practitioner or nurse practitioner who is not restricted under the laws of the province in which they practice from authorizing the use of cannabis. And a nurse practitioner is defined as an individual who is entitled under the law of a province to practice as a nurse practitioner or an equivalent designation, and is practicing as a nurse practitioner or equivalent designation in that province. And what that means, we define or license nurse practitioners as a nurse practitioner in a particular stream. Other jurisdictions have different names for a nurse practitioner. So the law had to, address what different jurisdictions license nurse practitioners as. And B is not restricted under the laws of the province in which they practice from authorizing the use of cannabis. So previously, as I said, before October 17th, 2018, because it was not approved by Health Canada, there wasn't a DIN number, there wasn't any monograph indicating what the dosage was. So the regulatory bodies made the decision that they would not authorize MPs to provide the medical document. But with this piece of legislation on October 17th, it actually said that it is now in the scope of nurse practitioners and is up to the jurisdiction to restrict a nurse practitioner. And so it was brought to the Nurse Practitioner Standards Committee. So before September 1st, any change in the scope of practice of a nurse practitioner had to be approved by the Standards Committee and then brought to Council for approval. That was done, and they, both the Standards Committee and CCRNR Council approved or authorized nurse practitioners to authorize the use of cannabis for medical purposes. And then an MP included in the definition is a nurse practitioner is not named in a notice issued under Section 335 that has been restricted. So the nurse practitioner under legislation, the physician or nurse practitioner or pharmacist can have activities restricted related to cannabis in this legislation. So if you meet those three criteria, then if you have the necessary knowledge, skills, and judgment, it's within your scope, you can authorize the use of cannabis for medical purposes. So under Section 272(1), a healthcare practitioner is authorized in the respect of an individual who's under their professional treatment, and if cannabis is required for the condition for which the individual is receiving treatment, then this healthcare practitioner can provide a medical document, and while practicing in a hospital, to issue a written order to receive cannabis for medical purposes. They can administer to the individual a cannabis product other than cannabis plants or plant seeds. And they can transfer to the individual or an adult who is responsible for them a cannabis product other than cannabis plants and seeds. And if you review the legislation, you'll know that in the legislation, it allows a individual to have the cannabis for medical purposes mailed to the practitioner, the healthcare practitioner. So that's, will require, if you have questions, you can certainly check with legal counsel on that and what your policy is for your employer. So they can transfer, it can come to the individual that has been received from a holder of a license to sell or a license for processing, and in respect of which the quantity of cannabis does not exceed that individual or adult is authorized to possess under Section 266 or 267. So these are the activities that a healthcare practitioner, meaning a registered nurse, a nurse practitioner or a medical practitioner can authorize the use of cannabis. So, and very important to see in that definition is that the individual has to be under the professional treatment of that physician or nurse practitioner, and cannabis is required for the condition which the individual is receiving the treatment. So medical cannabis has to be indicated for the condition that they are presenting to the practitioner. So it is prudent. That nurse practitioners ensure that their nursing assessment supports their decision that in their professional opinion, cannabis is required for the condition, and that clinical documentation accurately reflects the rationale for the plan of care. And while a patient may request that an NP authorize cannabis as a treatment, the ultimate decision rests with the individual nurse practitioner, who should be satisfied that the treatment is required for the patient's condition. So NPs are accountable and responsible for the decisions they make and are expected to use evidence-informed knowledge when making that decision. So again, as I pointed out, the NP must only provide a medical document for clients under their professional treatment. So the NP, there's a number of conditions or considerations that we outlined in our regulatory document for nurse practitioners authorizing the use of cannabis to reflect on when making that determination whether to authorize it for a client who presents to them. So for the nurse practitioner then to reflect on, does the client have a primary care provider? So if the client is presenting to you, consider the rationale for being involved in the authorization of cannabis for medical purposes when a primary care provider is involved in the client's care. So if this client this is the first time that a nurse practitioner is seeing this client, to reflect on, does the individual, the client, have a family physician or another practitioner who's their primary health care provider. The NP needs to reflect on, do they have enough information about the client to provide a treatment recommendation? And the NP needs to reflect on, does he or she or they know enough about the client's treatment history to determine whether cannabis is required for the condition? And can the NP adequately assess the client? For example, in virtual nursing care, if you're doing it through means like telehealth, telemedicine, Skype, are you able to have the full history of the client? And does the client understand the risks and benefits of proceeding with cannabis for medical purposes to treat the condition? Again, informed consent. The nurse practitioner needs to review the risks and benefits. And if the nursing care is being provided remotely, for example, through, as I said, virtual nursing care or telenursing, is the client under the nurse practitioner's professional treatment when practicing telenursing? So it's really important for that nurse practitioner to reflect on, and whether they can properly consider whether clients' complaints can be addressed remotely, and have the NP manage the risks associated with providing an assessment via telehealth. So it's really important that the nurse practitioner reflects on these requirements. Additionally, when the NP is going to authorize the use of cannabis, the NP must assess whether cannabis is the most appropriate treatment and consider available evidence in support of cannabis, as well as the evidence regarding risks and contraindications. And as you know, cannabis has only been legalized for a year, and previously to October 17th, 2018, there wasn't a lot of research being done on cannabis because it was illegal. So some evidence is being generated through research, and McMaster University, I believe in Ontario, is the center of research for cannabis in Canada. There's also one facility or one university in the United States that is dedicated to doing research on cannabis. So there are more studies coming to fruition, and as more research takes place, there'll be more evidence to consider. It is also important for the MP to educate the client on the risks, the benefits of cannabis, including its therapeutic effects, side effects, contraindications for other drugs, the safe transportation and storage of cannabis, as well as the importance of obtaining cannabis from an authorized supplier. And under cannabis for medical purposes, clients can only receive cannabis for medical purposes through a licensed producer. And that medical document is mailed to the licensed producer, and that is then released and put in the mail to the client. Nurse practitioners who authorize the use of cannabis for medical purposes are accountable to have the necessary knowledge, skills, and judgment to provide the medical document and to maintain their competence through educational courses and training. And the College of Registered Nurses of Newfoundland and Labrador does not require the completion of a mandatory educational program. Health Canada does have a guide on their website for healthcare professionals that are participating in the authorization. But as I said, Health Canada has not given a DIN number, but they do have lots of resources online for healthcare practitioners. But we at the college does not require any mandatory educational courses. So the nurse practitioner is expected to maintain competence through educational courses. It's essential for the nurse practitioner to acquire and apply up-to-date knowledge of cannabis as evidence for its use evolves. As I said, as more research comes on, there'll be more knowledge that the nurse practitioner can apply to their practice. And with the legalization of cannabis, it's anticipated that more rigorous research will be undertaken to provide more evidence-informed indications for cannabis. And every day we see in the literature more evidence for the use of cannabis for different medical conditions. So as a summary, if a nurse practitioner is contemplating undertaking any activities with cannabis, they are required to be knowledgeable of relevant federal and provincial legislation. They need to be knowledgeable of the Cannabis Act and the cannabis regulations, for example. They need to practice in accordance to the standards of practice in the Code of Ethics and other relevant college documents. They need to ensure that their activities fall within the individual MP scope of practice. And then they need to ascertain whether the activities can be undertaken in the employment setting, including self-employment, and review any applicable employer policies, guidelines, procedures, and/or processes to guide the MP's practice in relation to cannabis for medical purposes. They need to ensure that they have the necessary knowledge, skills, and judgment and individual competence to participate in these activities safely. And this may include participating in additional educational courses and training. They must determine when they provide therapeutic interventions to only do so to individuals under their professional treatment. And they authorize cannabis for medical purposes only when it's required or shown in evidence to be a therapy for the condition which the client is receiving treatment. They need to obtain informed consent in accordance with legislation, regulatory standards, and employer and agency policies. And consent may include a signed treatment agreement. And they need to thoroughly document their assessment and the determination that cannabis was required for that condition. And as you may or may not be aware, there was new legislation come into force on October 17, 2019, and these were regulations amending the cannabis regulations. And these new regulations were enacted to establish new regulatory controls to address the public health and public safety risks associated with the 3 new classes of cannabis. And these include edible cannabis, cannabis extracts, and cannabis topicals. And while permitting the sale of these new classes of cannabis, the amending regulations aim to reduce the appeal of cannabis products to youth, the risk of accidental consumption or overconsumption, potential health and safety risks, including the risk of blood-borne illnesses associated with the reduction and consumption of edible cannabis, and the risk of dependence and other negative health outcomes associated with these products. So it will take time before these new cannabis products become available for purchase. The public should only expect a limited selection to appear gradually in physical or on online stores, and no earlier than mid-December 2019, and it will take more time before a full range of products are available. Prior to October 17, 2019, the forms of cannabis that were legalized were dried cannabis, cannabis oil, fresh cannabis, cannabis plants, and cannabis plant seeds. But after October 17, 2019, with the new amendments to the regulations, we have more categories. There were 3 new classes. So it's edible cannabis, which is either eaten or drunk. There's cannabis extracts that, and this is where you'll see that cannabis oil moved over into cannabis extracts, so you ingest it or inhale it. There's cannabis topicals, which apply to the skin, hair, and nails. There's still dried cannabis, fresh cannabis, and cannabis plants and cannabis seeds. So I thought I'd include some statistics, and this is particularly for registered nurses and nurse practitioners that may have questions and will be caring for clients now who are using cannabis for medical purposes when they present to the hospital or are admitted. So Statistics Canada released a national cannabis survey. They released their 3rd quarter data, 2019, in October, and it revealed among those who use cannabis that the largest consumers are in the age groups of 14 to 24, and that makes up 25%, and then 26% of ages 25 to 44. It found that 65 years or older are less likely to consume than younger Canadians, so they're only 7%. And they're 65 or older are more likely to purchase exclusively from a legal source. They're generally more likely to consume for medical purposes, and they're less likely to use daily or almost daily. But what was so interesting was that seniors, 65 or older, are their age group showing the most growth in cannabis usage. And more than 1/4 of the seniors who use cannabis are new users. So that is a really startling statistic, and that the average age of cannabis users has risen from 29.4 years in 2004 to 38.1 in 2019. And currently, as of the 3rd quarter in 2019, we have more than 5 million Canadians reported having using cannabis. So just some interesting stats as we have clients presenting to us to the, our practice settings having used cannabis. So some general information to reflect on when educating clients and patients. When clients present, and being aware of some side effects, and that when clients use cannabis, they generally see an increase in the heart rate, there's affected mood, there's altered senses, but there's also some impairment. They often may see some drowsiness, impaired ability to concentrate or make decisions, but there's also adverse effects, and this could be psychosis, where there's delusions and hallucinations when taken in higher doses. A side effect could be nausea and vomiting, but with long-time use of cannabis, it can lead to cannabinoid hyperemesis syndrome. There could be dependence, cannabis use disorder, and often with long-time use and higher dose use, there's worsening or bringing on of disorders related to anxiety and depression. And when using alcohol and other drugs, it can increase or cause more severe levels of impairment or adverse effects. So just some things to think about when your clients, has presented using cannabis and to be aware of. So just to think about some of the new classes under eating, drinking, and swallowing, and that would include ingesting a capsule or swallowing a dispensed amount. If clients are new consumers, then they could be looking for information, and they might ask you as a registered nurse, well, how much should I take? Well, the literature has suggested, and the law has said, and I guess as the Public Health Agency of Canada has put out some recommendations as well, is that they should look for products that contain 2.5 milligrams of THC or less. That's if you're a new consumer. And clients may ask you, well, how long will this, if you're taking eating, drinking, or swallowing, how long will those effects be? Well, effects are felt within 30 minutes to 2 hours, but it can take up to 4 hours to feel the full effects, and potentially the effects could last up to 12 hours. And consuming more within this time period can result in adverse events or effects that may require medical attention. And these are the clients that may, with this new law and people, ingesting, may present to you. So it may be something that becomes part of the nursing assessment, is determining how much that they've consumed. And on the packaging, you will see that the total amount of THC in the package of edible cannabis can be up to 10 milligrams per package, and cannabis extracts, which is ingesting, for example, like capsules, will be 10 milligrams per unit of THC, or 1,000 milligrams of THC per package. So you may see 100 10 milligram capsules. So really important that you be aware of some of the things that you will see clients present with this new classes of cannabis. So for topicals, you may see that on the packaging there's a limit of 1,000 milligrams of THC per package. For inhaling, if clients are starting inhaling, then you would recommend to the clients that they should start to 1 to 2 puffs of a vape or joint with 10% or less THC, or 100 milligrams per gram, and that the effects are felt in seconds to minutes. It can take up to 30 minutes to feel the full effects, and effects can last up to 6 hours. And cannabis extracts, as I said, is limited to 1,000 milligrams of THC per package. So for some resources where this is new legislation, Health Canada has come out with some resources that healthcare professionals and the public can use when using these new classes, and they have it broken down into a table, and you'll find that on this slide, the final regulations regarding edible cannabis, edible extracts, and cannabis topicals. So great information, and then I have a link there in this slide to the new cannabis regulations that will help you inform of what the legislative requirements. And the final slide is some resources for registered nurses and practitioners that was used to develop our regulatory documents, and also to use as resources when you're participating in those activities. And I'll draw your attention to the very bottom. The Public Health Agency of Canada has new cannabis toolkit to educate health professionals. So really excellent information there if you want to use that as a resource.